Hello everyone, and welcome back to our channel. Today, we're diving into a fascinating and complex autoimmune disorder known as Lambert-Eaton myasthenic syndrome, often abbreviated as LEMS. This rare condition affects the communication between nerves and muscles, leading to muscle weakness and fatigue. Understanding LEMS requires a grasp of the underlying mechanisms and its connection to other medical conditions, particularly certain types of cancer. LEMS is primarily caused by autoantibodies that block the voltage-gated calcium channels in the presynaptic membrane of the neuromuscular junction. This means that when a nerve impulse is sent, the release of acetylcholine, a neurotransmitter that signals muscles to contract, is impaired. As a result, the muscle fibers do not receive the appropriate signals, leading to the characteristic weakness associated with this syndrome. Interestingly, LEMS often appears as a paraneoplastic syndrome, which means it can arise in patients with certain malignancies, most commonly small cell lung cancer. The symptoms of LEMS can vary from person to person but often include muscle weakness, particularly in the proximal muscles like those in the hips and shoulders. Many patients also experience ocular symptoms such as ptosis, which is drooping of the eyelids, and diplopia, which is double vision. Interestingly, unlike myasthenia gravis, another neuromuscular disorder, the weakness in LEMS may improve with activity. Patients often feel stronger with repeated use of the affected muscles. Diagnosis of Lambert-Eaton myasthenic syndrome typically involves a combination of clinical evaluation, serological tests for anti-voltage-gated calcium channel antibodies, and electrophysiological studies. One of the key tests is repetitive nerve stimulation, where doctors monitor the nerve's response to repeated electrical stimulation. The characteristic response in LEMS is an incremental increase in muscle strength after a series of stimuli, which helps differentiate it from other conditions like myasthenia gravis. Once diagnosed, treatment of LEMS may involve a multifaceted approach. Patients may benefit from immunotherapy, such as corticosteroids or other immunosuppressive agents, to reduce antibody production. Moreover, symptoms can also be alleviated with drugs that enhance the release of acetylcholine, such as 3,4-diaminopyridine. In cases where LEMS is associated with an underlying malignancy, addressing the cancer through appropriate oncological interventions can be crucial in managing the syndrome. Living with LEMS can be challenging, as the fluctuating weakness may impact everyday activities. For many, occupational and physical therapy can be beneficial, focusing on strengthening exercises, mobility, and strategies to conserve energy. Support groups and counseling can also provide valuable emotional support and help patients cope with the psychosocial aspects of living with a chronic condition. As we wrap up, it's important to note that awareness of Lambert-Eaton myasthenic syndrome is essential, not only for patients but also for healthcare providers. Early recognition and intervention can significantly improve the quality of life for those affected. If you or someone you know is experiencing unexplained muscle weakness, especially in the context of other symptoms, don't hesitate to consult a healthcare professional. Thank you for joining us today to learn about Lambert-Eaton myasthenic syndrome. Be sure to like, subscribe, and hit the notification bell to stay updated on our latest content. Stay healthy, and we'll see you next time.